Thanks, John. You've mentioned one of the reasons why it's good to be here today. I'm from Clitheroe, so it's always good to come back near home. The second reason, actually, in terms of European affairs, this AHSN, to me, from my experience working across England, gets the issue of Europe much more closely and much better than any other AHSN. So that's why it's again good to be here. That may result in some better quality questions. So I probably should have prepared more, but there you go. So, who am I? Who do I work for? I work for the body called the NHS European Office. There are 5 of us. 4 colleagues based in Brussels. That's the landscape we have to try and affect and influence. I'm based in London with a national wall in England. Trying to align the NHS agenda with the EU agenda, so that's pretty difficult. We cover anything of any EU development we think could impact the NHS. That could be for better or for worse. Of course, the Working Time Directive. I'm the son of a haulier, and I think we were probably started when the NHS suddenly realised that the Working Time Directive wasn't just about hauliers, for example. We've just had recently agreements on procurement, clinical trials, etc., etc. Whole host of legislative developments which affect the NHS. European funding, of course, that's why I'm here today largely, but we'll cover a broad angle. European funding is very relevant for the NHS, and there's something, and we're seeing it much more now, about like importing and exporting good practice, innovative health models. We all have the same challenges across Europe, so there's something there for us. Normally, if I'm speaking to an NHS audience, I will be talking about what Horizon 2020 is. But actually, I'm very conscious that, in my experience, academics are much more aware of European funding, especially European research funding, than NHS colleagues. So today, I'm going to talk about a rough guide, a cross-sectoral guide to getting the most of it. So we'll talk about Horizon 2020 as a funder, we'll talk a bit about it as a collaborator. This, for me, is really interesting. Horizon 2020 is a driver, and that's a driver of regional growth, a driver of how we can work together to achieve from Europe what we want to help us as we plan our local agendas. So this is where I think some of the really interesting developments will come up, and I'm going to talk about some developments from the European Commission's perspective, which it directly links to Horizon 2020 and it indirectly links to Horizon 2020. But it's that Commission perspective of the tools that it's open to it, and how it, as a region, as a health service, as academics, we can make the most of those. So let's start with the basics. I guess we all probably know Horizon 2020 involves some big figures. We know it's the EU's flagship funding programme. Interestingly, this was the only budget, the only EU budget line that the UK government wanted to increase during the last round of EU negotiations. So member states get it. It is an area of clear added value. Member states tell the EU to do this. So we expect Horizon 2020 to be a bit simpler than past funding programmes. So we probably understand the basics in this room. Why I've included this slide? Well, we consider in the NHS, I'm sure we do in this room, demographic ageing is the biggest societal challenge facing us. So does the European Commission. So that's a great start. So we're looking at Horizon 2020. We're looking at this budget line here. We're looking at €7.5 billion over 7 years in our area, in the areas which affects healthcare delivery and health research. Really interesting, great to see. That's a good marker of intent from the Commission. In terms of looking back, first of all, because this is where it gets interesting, I always have 2 measures in terms of the European research funding programmes. One measure is, do we get the money? And a second measure, do we get impact? Well, you can see from this, looking back over the past 7 years, we get the money. So the UK is the biggest recipient of EU health research funding in Europe. Pretty impressive, and often jaws drop when people learn that in this country. So more than Germany, you're looking at close to €100 million a year coming from the European Union for health research funding in the past 7 years. But we're going to dig a bit deeper, and of course these are pretty artificial barriers, but if we look at the partners who are listed on all those funding programmes, those projects which have had European funding in the past 7 years, in the UK, we're looking 80% of that UK partnership, that UK money coming into our academic institutions. Where is the NHS? I mean, it's very slowly increasing. It's a bit part player. 5-6%. SMEs, probably something similar. So yes, we get the money, but I'm looking at impact. I'm looking at health service delivery. I'm looking at the commercialisation, take-up of new products, the design of new products. If the NHS and SMEs aren't there at the table, I don't see how we can get the impact. So for me, there's something about, yes, using the experience we have and keeping the money coming in, but rebalancing this UK equation of who's involved in European funding. And we'll go on to how that might happen. But I think real opportunities there, real opportunities. Please do feel free to interrupt me at any point if any clarifications or questions. Some slides I often give NHS colleagues, where was the NHS? We know it's played a minor role in the predecessor to Horizon 2020. Largely, of course, teaching hospitals, specialist providers, that won't be a surprise. Strong biomedical focus in some of the areas it's been involved in, again, probably not a surprise there. They're probably the part of the NHS best equipped with the biggest resources to get involved in this agenda. I'd like to link up where innovation is needed in the NHS and where innovation often happens in the NHS with involvement in European funding. And actually that's community and provider level for me. So there's something there about how we broaden the NHS involvement in European funding. CCG is really interesting. How do we get CCGs and commissioners involved going forward? That's going to be a hard task, but they're slowly getting up to speed. And I think when we come on to some of the issues we'll come on to soon, hopefully we'll understand how we can work with them, but a strong acute focus as we know it. So I just wanted to bring the section about Horizon 2020 as a funder to a pretty quick close. These are some pretty much anecdotal areas of feedback from my experience. We get the money, our academic colleagues get the money, but actually the impact on that health service delivery locally and nationally isn't as significant as it could be. Linked to these two reasons here, I speak to vice chancellors; they fully understand European funding, and that culture of having their academics try and access it. I get blank faces from the NHS board level. That's if I get to NHS board level. Third point there, really interesting point. How much of that past UK involvement in FP7 actually was through clinicians, but with their academic hats on? Because the managers and the board level in the NHS trusts actually didn't engage and ask them what they're doing and try and link it back to the work of that organisation. So actually, I see a gap between board and clinical workforce across the NHS. And actually that's a gap that needs addressing if the NHS is to truly harness this money and this change and some of the innovation. Where the NHS has, shall we say, dipped its toe in the water, it's been pretty episodic. I think it's been on a certain issue. I don't think there's been any thought about, I am a trust which specialises in this or which has a vision to do this. Therefore, how do I look at a complementarity of funding to get me there? I think it's been an individual who's seen a budget line related to a certain area and they've gone after it. So I always say to NHS colleagues, look at your organisational vision, the clinical excellence, that's probably where you should start. But we've had episodic interest. Limited appetite for the long haul. There's numerous barriers that my NHS colleagues will tell me to getting European funding if they know about it. And these can be incredibly simplistic barriers. The audit process is different. Well, actually, that's dependent on us in the NHS believing our audit process is actually the norm. I'm not sure it is. So, plenty of barriers which puts NHS colleagues off. And yet, such an important last point. So much of my time is spent talking to non-NHS colleagues or talking to other health system representatives and colleagues from across Europe. The perception of the NHS is still incredibly strong. The branding is incredibly strong. Working for the NHS European office is probably the easiest lobbying job I could have in Brussels because everyone knows what the NHS is. What's quite interesting sometimes is where you try and link up the perception of others from the NHS and our own perception of the NHS. Often not the same clinical strengths, shall we say. So, Horizon 2020 is a collaborator. So not just as an institutional funder, as a collaborator. I couldn't come to this region and not focus on this example. Probably someone here in the room probably worked on it. We have an FP7 local example to Liverpool which scored 15 out of 15 in evaluation. The national contact point fell off his chair when he saw that. That's unheard of. And actually this was a coordinator, was the Royal Liverpool Hospital, and the University of Liverpool was a partner. Fantastic example of actually FP7 using that local collaborations to develop local relationships to build in new European colleagues. So I just thought I'd point out a local example of how actually it can be done. But let's move on. I will have the full results of the first call of Horizon 2020 later this month. If you've been involved, you may have heard already whether it's success or fail if you've put a bid in. But what we know from the results and the data feedback to date is look how competitive it is. I mean, if you're putting a bid in for mobile health, it has to be good. And I hope it was good. So we know that if you still want that purely institutional view of applying for Horizon 2020, you need to make your application incredibly good. They were the single stage projects. Two-stage projects, again, you know, it's the same message. Look how competitive it is. You know, and actually, this two-stage process is meant to be a filter in the middle. The Commission, I think, were pretty much overwhelmed with what they got and the marks some of the projects got. So I expect actually a real strengthening of what they see as their filter going forward in two-stage proposals. I mean, yeah, it's meant to be pretty much a ratio of 3 to 1 when you get through to stage 2. Understanding ageing, 170 proposals got through. They wanted to fund no more than 12. So actually, if we're going after Horizon 2020, the Commission are forcing us and urging us to collaborate because they really do want to see the best come forward. And what the Commission are also doing, they're funding through Horizon 2020, or they're linking in Horizon 2020 to many other European funding calls. So previously, you know, you could accuse it of being pretty much in isolation. I'm going after this funding pot. This is what I'm going to do. The Commission now are saying, link them together. Take one, take the money, develop your project, go after another. So I think the Commission are trying to stimulate those collaborative thoughts too in our mind. You probably saw the European Commission's consultation recently on what the next 2-year work programme should focus on. They were the areas listed. We'll have a version of that, no doubt, next spring. Early intelligence, but again, I mean, you know, they're pretty vague, of course, but absolutely what the NHS should be involved in, those areas. Absolutely where health research should be focused. So there's something about early warning, early intelligence, early collaborations. And when talking to the NHS, of course, you know, it's that difficult challenge of giving them enough warning to get their minds and thought processes going, but also the NHS, sometimes you go to it too early and the winter pressures take over. By next spring when it comes out, there will be some other pressures. So a summary of the collaborative elements of Horizon 2020. A success rate of only 3% in some areas. Even for an EU member state which is very successful in accessing it previously, this is providing us new challenges. This is telling us that you need to act differently to get the money than previously. All these are reasons why the NHS should be coming on board, by the way, reasons which, you know, I give to NHS colleagues. What the Commission want to do is to try and stimulate, recognise, involve more peer groups across Europe. So many of our clinicians are involved in European peer groups. Again, the board of that trust will not know, and there's a real, I think, a weakness there. But actually, let's get these clinical peer groups recognised, funded through Horizon 2020. There's a focus on excellence and specialism more in the NHS now, I would say. Again, a real fascinating point there about how the EU focus can help your trust specialise. That's important for NHS organisations to know as they develop that Europe is a potential avenue for them. We're slowly getting there, I think, with the NHS. Of course, you know, no NHS leader can ignore the financial constraints he or she will be operating under now. And actually that complementarity of funding, you cannot simply expect to receive funding in the way you've received it and be a sustainable provider in a sustainable healthcare service and model going forward. So I think that innovation is being hardwired into the NHS, and institutions like the AHSN are a key part of that. EU funding, again, is a great multiplier and should be part of that innovation agenda. And another one there, better collaboration can mean better intelligence. Impact is what the Commission wants. Impact is what the NHS wants. We can't deliver that on our own. I don't think the academic institutions can deliver that on our own. So all the messages, all the wind is blowing in the same direction. But this is, for me, where it gets really interesting. Horizon 2020 as a regional driver of growth, So we know about the EU as a driver of growth. It's the world's biggest trading bloc. You know, sometimes I think people forget this when they look at some of their international work. They look at, you know, going to the Middle East or the North America. This is the world's biggest trading bloc. We have a common regulatory framework across many areas. So actually, you know, partnerships within the EU can be long-standing, can be based on synergies, based on similar markets. Research and development is in the EU treaties. It's something the EU will be doing for a long time. And why is it doing it? Because it wants to win a global race. This is a strength, a perceived and a real strength of the EU. It sees itself as a driver of growth. So when we see the EU as a funder of research, we have to see it in the context of a driver of growth. Lots of associated regulations there. We'll come on to those, clinical trials, medical devices, data protection, etc. But we know about EU as a driver of international growth. We may only know about it as a funder, though, because we haven't looked at the tools of the EU, and this is a busy slide, and we'll come back to it later. We haven't looked at the tools the EU has in its arsenal in totality. I mean, it's a work of art, this slide. I don't know whose job it was to put it together, but you know, I take my hat off to them. So 4 corners there: finance, knowledge, human capital, markets. And Horizon 2020, pretty much all 4 corners, and it's slap bang in the middle too. We're going to come back to this and look at it with fresh eyes after what we've spoken about in the next 10 or so minutes. But the Commissioner sat there in Brussels, pulling their levers, pressing their buttons, trying to work out how the interlinks between them all to help us regionally take advantage of what they're trying to do. You can see there, you've got the circles, funding, and then you've got 6 hexagons, policy or legislation. We'll come back to that slide. But that's a great cut out and keep guide to what the European Commission sees as its levers. So what I wanted to talk about really is actually the perception of the European Commission, which is a new way of looking at health at the European Union level. So I've picked out 6 key areas I've seen recently from following the EU agenda. The first one, I've got a few slides about this, a succession of very relevant, very interesting, innovative and new models of fostering collaboration. And these will all link into Horizon 2020. I'll come on to 2 in particular. We're seeing far more alignment between legislation. So if you follow the policy agenda, you'll notice Clinical Trials Directive, now a regulation. Data Protection Directive will be a regulation. Medical devices will be a regulation. Harmonisation across the 28 member states. Harmonisation across the markets. Industry have been pushing for that. That's part of their growth agenda, part of their innovation agenda. So legislation is a key enabler in this area, and it links directly to funding. More direct involvement in national health systems. So of course we've always told the Commission, keep at arm's length. This is the NHS. We decide how it's funded, resourced, planned. Some other member states, of course, probably the member states initially which have had financial problems, which have had the troika in Europe, help them, give them money. They've actually been asking the Commission to come in. Tell the member states how it can be sustainable. Tell the member states how they can work in future to retain their workforce, to use growth, to keep their health systems afloat. And there's some real sliding scale of difficulties faced across Europe. So for the first time, you've got the European Commission actively telling member states how their health systems should be arranged. The Commission set up its own expert groups on investing in healthcare. So there's academics in there, there's health practitioners, high-level group, and they're looking at issues such as primary care, competition, public-private partnerships, access to healthcare. So the Commission are getting directly advice from top-level groups on some of the key issues facing healthcare systems. Really interesting. It shows that the Commission isn't just there, sat idly by watching the 28 different health systems diverge. They're trying to act. Well, I've got a slide about increasing the sum total of its funding tools, and I'm going to mention very briefly something called smart specialisation, which you may or may not have heard of. It sounds Euro jargon, it makes a lot of sense. So these are all parts of a new way of looking at health in the European Union. This is really interesting for me. So this is one of the new innovative collaborative tools the European Commission is trying to foster. So from next year, we will have a call out asking for networks of specialist healthcare providers across Europe. So this is the centralisation and rationalisation of healthcare on a European scale. So of course, by definition, it has to be quite a limited number of areas in which they will focus. And rare disease is the obvious starting point. So for example, if I provide proton beam therapy, not every member state in Europe should have 10 providers of proton beam therapy. It doesn't make economic sense, it doesn't make sense for the patients. How do we link those up across Europe? How do we link, and to be a member of this, you have to have a teaching and research arm as well. If you have a local trust or provider you think should be in this specialist network, how do you as secondary organisations link into that? Really interesting. Yes, it's rewarding excellence, but as part of a good regional plan, actually it's giving you the ability to reach international scale on that plan, and it gives the secondary infrastructure and community around it something, I think, which will generate income, bring patients across and generate interest in the region. Did you mention Genomics England? I thought I heard you mention that. If you're putting a bid in to be a Genomics England centre, that in itself is almost like a reference network. We just need to take it to the European level. Really interesting because, again, it shows the European Commission explicitly getting involved in trying to formalise these links. And actually, what are the starting point for many of these links? Informal clinical peer groups across Europe. And we've already spoken about that, haven't we? How the NHS board don't take advantage of those clinical peer groups. To be involved in this, you have to have a board decision. So I'm hoping things like this try and narrow that gap between the clinical workforce and the board. This has to be an organisational decision, whether to get involved in a European reference network, not a clinical decision. There's no upfront money, well, at least at the moment there's no upfront money, but the perception, the European Commission are explicit about this. You should be involved in Horizon 2020 bids every year if you are in a European reference network. So really interesting for me is that, and we'll wait and see how many NHS trusts are interested in that. Again, because it's Europe, we have to tap trusts on the shoulder and try and get them involved. But I mean, the question, do you consider yourself a world leader in a certain speciality? Quite often say yes. In the NHS, we all consider ourselves to be specialists in something. Well, the key is the next step is international collaboration. I'll just touch briefly on the European Innovation Partnership because just down the road in Liverpool, you have a European reference site. So many people in this part of the world probably already understand it. So the European Commission, it looked at some societal challenges, probably about 3 years ago now. And it looked at areas where it had the public and the private sector and research closely aligned. It looked at areas where it could make immediate short, along with medium and long-term gains, and areas where it wanted to broaden the number of stakeholders involved. And it wanted to pilot a new way of working. And this was the European Innovation Partnership. And it chose active and healthy ageing as the first pilot in Europe. So it chose the area we're interested in as its lead, as its pilot, as its way to get involved in this agenda. So it wants to bring together different actors. In particular, it had something really interesting. It had something which was to foster what they call European reference sites. Regional sites who can test, research and market new innovations and new ways of working all within that region. So really interesting. I think there's 32. Liverpool is one, Yorkshire is one. Liverpool for assistive living, Yorkshire for e-health. So there's 2 in England. You'll notice none in London, none in the southeast. Talking about the Golden Triangle, they're not in this. They probably don't even know about this. But you have a reference site locally, and there's one in Yorkshire. Scotland, Northern Ireland and Wales are all reference sites in their own right. So really interesting that just down the road you've got something which, again, if I'm looking for partners for Horizon 2020 and I'm in Denmark or I'm in Finland, who am I going to go to first? A European reference site. I perceive them to understand the European context. I have a contact point and I know they've been registered and stamped with approval by the European Commission and by peers. So a really, a starting point for collaborations. Make the most of that. What did I mean by increasing the sum total of its funding tools? Well, again, I'm coming back to that point of what the Commission, the importance the Commission places on the demographic challenge facing us in healthcare. It's the biggest societal challenge listed in Horizon 2020. Horizon 2020 has much more focus on the commercialisation. So the European Commission no longer wants to use its money to fund pure research. And this is both what drives or should drive more involvement in the NHS, and it should drive more collaborations between academia and the NHS and industry. It's much closer to market than its predecessor was, and that's one way of getting AHSNs in and the NHS in, a really key part. I've mentioned structural funds there. Now, this isn't a discussion about structural funds. I don't know if you know about structural funds, but actually the conversations around Horizon 2020 are to some extent being mirrored around structural funds in the higher education institute sector as well. HEFCE are very involved in it, and I'm working with HEFCE on this. Structural funds traditionally haven't been spent in healthcare. They've been spent on large-scale infrastructure projects. They've been, probably building science parks, for example. They've been spent in other sectors, agriculture, technology, etc. They've never really been spent in healthcare. And even the Commission have often said, no, you get the research funding in health. This is for other growth areas. Well, actually, there's now an accepted vision in the European Commission. Health should be part of structural investment funds. And we'll come on to why these provide some good opportunities. A lot of increased investment in pre-commercial procurement. Probably that may have come up today, I don't know, I missed the first session, as something which the AHSNs really are well placed to get involved in. So the Commission is really trying to use the health sector to drive new products and to get industry involved. How can we link up with academia on those? There's a knowledge innovation community. I don't know if you're familiar with those. These are huge pan-European initiatives to try and foster that triangulation and to drive entrepreneurship in certain societal areas. There was a climate change one recently, an ICT one. There's now a health one, and they're going to decide on the 9th. So next week, the final 3 have got down to, they're going to be judged in Budapest, the final 3, to see who gets involved in that kit. And you're talking about 250 million euros there.
Where is that, Mike? Where is it?
Fantastic. I thought you were. There's several HSNs. There's 3 UK involved ones, and best of luck, because that could be a game changer to link everyone in this room with the health sector, to get entrepreneurial spirit going, to bring industry in. Could be a game changer. Again, shows the Commission is investing in healthcare. Social innovation has been strengthened across the board. What is social innovation? Well, actually, it's what we do in healthcare. Primary care, community care, it's what we do every day. But some of our colleagues, we need to try and make that more clear, I think, for colleagues. And they're bringing out the SMEs. And all the political discussions from Brussels, how do we get more SMEs involved? Well, actually, speak to SMEs, and that's what the HSN does, isn't it? Speak to SMEs in this country. They want to get involved in the NHS. We can help each other to help each other here. I mentioned smart specialisation. I'm no expert, but I wanted to touch on this because it really is of interest, as much of an interest for academics as it is for people in the health sector. The European Commission has a definition of smart specialisation. I've just pulled 2 quotes out, so by all means Google it. So smart specialisation is a new innovation policy concept designed to promote the efficient and effective use of public investment in research. Its goal is to boost regional innovation in order to achieve economic growth and prosperity by enabling regions to focus on their strength. It understands that spreading investment too thinly risks limiting the impact in any one area. So actually there's going to be as many losers as there are winners there. But what it's saying is you're investing, and investment is finite. So choose your areas to invest in based on your strengths. And if you look at this quote underneath, it needs to be based on a strong partnership between businesses, public entities and knowledge institutions. Such partnerships are recognised as essential to success. So if the European Commission is trying to navigate us down a regional agenda where health is a key investor and stimulator of growth, this is something which actually we should be looking at. And you have the ability on a regional basis through an HSN to actually do this. So just to summarise that part then of what I was saying today, we've seen a really renewed EU focus on a societal challenge of the ageing demographic and a direct link to growth. It's direct, it's not implicit, it's explicit, the link to growth. This is why healthcare and healthy ageing is getting so much investment from the European Commission, because it's been identified as one of its key drivers for growth. Horizon 2020 is now better linked to existing programmes, and critically, it's got a lot of feeder concepts. Those European reference networks, that European Innovation Partnership, they are direct feeder networks for Horizon 2020. I would say the Commission's not moving the goalposts, it's actually widening the goalposts from our perspective. It's moving away from what it perceived as institutional, sectoral engagement to actually regional input. It wants test bed sites. It wants you to do everything in your region and to link that with other regions. So in, through and with Horizon 2020, you have the opportunity to drive regional change. And that's something which is fascinating, because that's a far different way of thinking, I think, to previously how we've engaged with FP7, for example. And of course, that's at the commission. That's in Brussels. That's at the Commission's perspective. What's happening this side of the Channel? 5-year forward view. Recently in the NHS, it sort of unlocked the central chains of command, I would say, from Leeds or from London on how we assemble health and care systems. It said, we are going to enable and empower local healthcare delivery. Of course, we've just heard the news about Manchester, and local authorities are being urged to come together by the government if they want infrastructure projects, if they want money. Manchester's going to be moving quickly, Leeds and Sheffield to follow. So we have a time this side of in this country where there's a focus on local health and care systems and what works. There's a focus on, to use the word devolution, or at least regional empowerment. There's the triangulation of research, health and industry, through the AHSNs in particular, and there's a squeeze on the finances. And we always think we're being squeezed hard in the NHS. Speak to local government colleagues, and look, think about what local government has 5 years down the line. They're going to be looking for in higher education institutions in the NHS to take some of that burden and take some of that opportunity. So actually the challenge is not of central leaders and managers. The challenge going forward is of local leadership. Just wanted to come back to this idea of smart specialisation and bring the LEPs in, and I heard Liz mention the LEPs. Really interesting, and I pursue this agenda because actually I think Horizon 2020 is a key link here. It's really interesting how, if we can get those three sectors working together, perhaps using the principles of smart specialisation, you start singing from the same hymn sheet, to use that phrase, where it's a local community that matters, it's a local community pressures, local community interests, and the local community's excellence. So, if you bring in a European reference network, you bring in investment in Horizon 2020, you start talking about the same thing. And working with LEPs are devising strategies to spend European structural funds. That's what they're doing for the next 7 years, and they need match funding. Really interesting. I think it's two sides of the same coin, isn't it? We've got, on the one side, we've got that wealth creation, to use that phrase, agenda in the NHS. On the other side, actually, the NHS has a direct role in ensuring community resilience, and it's two sides of the same coin. Healthy workforce is a productive workforce. And that's a language LEPs understand. And and again, across England, we're at different stages of the NHS working with LEPs. I know colleagues in healthcare pushing universities to work with LEPs. We are both approaching LEPs at the moment. Structural funds is one of the key reasons, but Horizon 2020 will come to that. We need to shape that agenda jointly with LEPs, rather than universities with LEPs or with the health sector with LEPs. We need to have a joint approach there, I think. And a quick look through the LEP strategies. Several, probably the majority of the 39, have mentioned new innovations around health technologies, healthcare. All of them mention the need to get neat apprenticeships, upskilled into jobs, have a level of well-being which enables them to be productive and employable. Real opportunities for both sectors working with LEPs. And apologies for my horrendous play on a common Latin phrase there. I think the EU has thrown down the gauntlet to regions. The EU wants a step change in where its money goes, and it knows if there's money to get far further down the road, it's not institutions, it's regions that matter. I think the potential of having a regional strategy, talking about what we've just mentioned about excellence, of course, but also health needs and the extent of collaboration, if you can mirror those three together into a coherent strategy, actually this is real, this is tangible, this is very much achievable. New partners immediately opens doors to new opportunities. So we've mentioned LEPs, we've mentioned universities, we've mentioned the healthcare sector. We all have our own funding streams, and we all have funding streams we tend to access. Bringing those together enables you to get far further down the road. So, I think what the Commission have tried doing in Horizon 2020 is they've tried creating a good funder for institutions. That's undeniable, the figures are there. But they've tried creating, a good collaborator, especially for individuals, clinicians, academics. But what they've also tried doing is creating a key driver for regions. That's the thought process from the Commission. Of course, it's up to us how we play with that. So just to go back to this phrase, I mean, you know, we've changed the institutions with some of the funding streams. I understand it's not going to be easy bringing these two together. Biz have tried numerous times to have workshops where we can look at how we can link Horizon 2020 with structural funds. It's certainly not easy. But the opportunity is there. LEPs are being told to focus on Horizon 2020. They don't know what it is. Their funding streams are domestic. So structural funds, you don't need European partners. Horizon 2020, you need European partners. So if you get access this traditionally, you have skills and understanding and links LEPs don't have for this funding. But of course, on the flip side, you know, LEPs have something we don't have. So I think there's a quid pro quo there. There's sitting down and there's talking about a common agenda, how we bring together those funding strands. Of course, we all have our own regional funding as well. So let's look at this with fresh eyes then. Actually, you know, you're no longer just searching out for one funding stream or one piece of legislation. You know, we have the ability to look at this as a whole. And what's interesting, every time Horizon 2020 is mentioned, structural funds are mentioned. You know, the Commission sees them as the same, you know, as funding or stimulating a different part of the same equation, same sentence. So I think there's something really interesting. Whether you do want to access new markets, well, it's fine. Horizon 2020 is good for that. If you're looking for different financial instruments to use, it works. If you're looking to stimulate the research side, again, it's there. And if you want, you know, the movement of researchers or clinicians or that understanding, it's there again. So actually, you know, Horizon 2020 is linked in every step of the journey, but there's much more out there if you want to work together. And you know, and just the point, you know, look at those levers and fit with how it works with your regional plans. You know, that's critical. So some good, I mean, you know, you probably know this. These are some areas just finishing, I tell my NHS colleagues. You'll notice, where is it? This one in particular, talk to you. You know, that's why I often say to NHS colleagues, speak to your academic colleagues, you know, because you've got this money in the past. You have the processes, you have the understanding of what it can do. But there's a bit more than that. You know, there's about finding out, for example, we mentioned that Liverpool example. You know, fantastic. There's a local example with an NHS trust coordinating. I mean, you know, they are very few and far between. So there's something about finding out who's out there, who knows about this. It's a bit of data analysis, I guess, on behalf of the region. And then there's the new opportunities. SME groups, quite often I speak to SMEs about European funding, they'll tell me, never again. I tried it once, never again. You say, well, actually, the Commission wants you in. The Commission hasn't come up with these rules just to annoy you. It's trying to get you in and utilise public taxpayers' money in a different way. So come and have a try at the new SME-only programme. Give it a chance. We'll work with you. We'll help you. See how far we can get it. So I think Horizon 2020 almost resets the clock sometimes to some of these debates. This is a good point. What Liverpool did very well was they took the TSB, as it was known then, funding for the Dallas project, and used that to elevate itself to get European funding. So that's a really interesting point. The Commission wants you more and more to come into Horizon 2020 with an already funded partnership, which you can access and develop and grow using Horizon 2020. And key point to finish on. You know, the Commission has funded this, it's programmed, it's worked for years to come up with this strategy, it's issued it, it's going to issue its next 2-year work programme next spring. But actually, it's what you're going to do about it that matters, not what it does. So the question is, how do you want to utilise Horizon 2020? And I think that's my final point. If you want to keep track of my movements, follow us on Twitter and send me an email.